All right, well, this is a new series that we just decided to drop. The title of it's going to be Misconceptions and Just False Information. Unfortunately, in the musculoskeletal world, there's a lot of just bad information out there, and a lot of people, kind of get suckered or tricked into treatment and all sorts of things that they really don't need. So we want to try to be a source of information to help you navigate, a lot of the nonsense and difficulties of trying to deal with your injuries. So this week in our office, we focused on shoulder injuries. So you'd be amazed at how many times this happens. You go into an orthopedic doctor for a shoulder problem, and then usually they have an X-ray on site. So they go down, they take an X-ray, and then they come back and go over the X-ray with you, and then they diagnose you with a rotator cuff tear. The problem with that is the X-ray doesn't show the soft tissue at all. So they're not actually able to accurately make that call, but they do it all the time and they overstep their boundaries. Then that leads to usually a cortisone shot and then a recommendation of 6 weeks of PT for a problem that they don't even know if it exists. So if you've gone to the doctor and they've told you you have a rotator cuff tear or some type of slap tear or some type of degeneration solely off an X-ray, they're wrong and they're lying to you. You need to request an MRI and get a more in-depth look of what's going on with the tissue. A lot of doctors end up doing that because it's cheaper, the insurance will cover it, and they can jump through a bunch of little minor hoops to get you treated as quick as possible. But the problem is you need the full picture. You can't have an accurate treatment or resolution of your injury if you don't have a specific diagnosis, and that only happens with an MRI and being able to see that. So if anyone's told you you have a rotator cuff problem based off just an X-ray, they're lying to you and they're not being accurate, and they're not the type of doctor that you want to see. So if you ever have any questions, please feel free to email us or give us a call. We love talking about this stuff, and we're here to help you navigate all the nonsense that is the current medical model. We'll see you guys next week.